hands, but not enough to blow you over. We're going to give you the real forecast coming up in just a few minutes.
Okay, Brian, thank you. In the meantime, if you go to the hospital with COVID-19, there is a new drug that doctors at Blessing say they're using to try and keep at-risk people from winding up in the ICU.
They gave the first dose of that drug to a patient today.
WGEM's Frank Healy has been following this story. He is live in Quincy at Blessing Hospital with more on what this drug can do. Frank?
Dylan and Mackenzie, that drug is Bamlanivimab, and doctors say while it's quite a mouthful to say, they're hoping to use it to keep ventilator tubes out of the mouths of patients experiencing COVID-19 symptoms. They say that it's all to make sure that they don't wind up in a bed here at the hospital. As rapid testing continues in Quincy today, at Blessing Hospital, doctors are working to fight COVID-19 with something new.
Bamlanivimab, and it's a hard one to say, but this is a drug that actually gets infused into a patient through an IV and will bind up virus that's circulating in the bloodstream to prevent it from infecting cells.
Dr. Chris Solero, Blessing Health System Chief of Medicine, says today they administered the first IV of the experimental drug approved for use by the FDA. He says in layman's terms it works like this.
And we've all seen pictures of the virus with these spike proteins. This is a molecule that binds up the spike proteins and prevents that protein from entering a cell.
Dr. Solero says this drug wouldn't really help people already in the hospital, but it can help at-risk patients experiencing symptoms.
Typically, it's a patient who's had COVID-19 diagnosed, but it needs to be given typically within 3 days of a positive test. And those patients are not patients who are hospitalized. So these are patients with mild to moderate illness who don't need hospitalization, but are at risk for hospitalization.
He says some of those who are at risk are people with a high body mass index, diabetes, or compromised immune systems. Dr. Solero says they're working now on figuring out what exact circumstances call for them to give a patient one of the 95 doses they received from Illinois.
This may be in somewhat limited supply, but we'll treat people who are qualified and who consent to the process.